ankle, didn't get anything at the interosseous membrane level, didn't get anything at the fibular head level, didn't get any breath or flow. So I'm holding with my right hand. Remember that always the right hand is at the fibular head, whether it's the right or left foot or leg. And all I get is how strongly the fibular head is jammed posteriorly. And as I shake hands with it, it just keeps going further and further and further and further and further and further and further into the posterior jamming. Right? Tommy, can you close out the door? Is it all right? Okay. Is Patrick's just doing that one? Okay. Yeah, it's about feeding time for the mosquitoes.
Oh. Ooh, I have a citronella candle. Would you want me to bring it in?
I can't see doing that inside.
Huh?
I couldn't see burning it inside.
It's over there.
So it's going nowhere. So this is a perfect lead-in for our little springing of the fibular head, right? Our first little engagement of the thought of the application of some force. We have no breath and flow. Whatever I've tried now on this right fibula has not done anything. So I'm going to take this away. I have a special fondness of this particular procedure because, like I said, this is really my entry to osteopathy. I was working as a marine biologist, and I had a couple cuts in my hip waders and managed to get this horrible thing that looked like an infection in my feet. And I'd been to 6 doctors, 6 MDs in 3 counties, and they'd all give me different antibiotics and antifungals and all sorts of stuff. And nothing was getting better. It was getting worse and worse and worse. In the middle of all that, I was doing some marine work and carrying some buckets of samples up this mud cliff near where I lived, and did something, twisted this knee, and all of a sudden I couldn't straighten it and couldn't put any weight on it. So I had this thing that looked like animals were gnawing on my feet that nobody could diagnose, and I had this leg that I couldn't walk on. Well, the guy happened to have been in the Navy and saw my feet and said, "You've trench foot, son," and gave me the cure for trench foot, which is when moisture, leaky boots, leaches away all the lubricating emollient oils in your feet, and just break down. So within like 5 days, I was like 90% better from what he suggested.
What oil? Just oil your feet?
He used Eucerin cream. For 2 days he used steroids, and then it was Eucerin cream, and then it was do not wear anything except 100% cotton socks. And for God's sakes, don't get your feet wet. So I had to farm out a lot of the contracts I was doing. And then I'm hobbling back to get my clothes on. He said, "What's wrong with your foot or your leg, son?" I said, "That's a really good question. I've been to like 4 orthopedic surgeons. Nobody knows what's wrong with it." And he looks at it, and he looks pretty pissed off. And I said, what's going on, Dr. MacGyver? He said, "Well, I'm a surgeon. I'm in my ear, nose, and throat fellowship in Portland, Maine. But you probably didn't know this, but I'm an osteopath. I'm a DO. And I don't believe in this manipulation crap, but I'm convinced that you've got something wrong with your leg that only a manual treatment will solve. See, this bone here, called the fibular head, is locked back here, and it's impinging the nerve, the peroneal nerve going to your foot. And every time you straighten your knee or try to put weight on it, it's basically macerating that nerve. Now, there's probably nobody within 300 miles that can do this procedure, so if you're willing to bear with me, I haven't done this in years. I've got the manual in the closet. I'll bring it out. I'll put it on a little chair. And put this little thing, chair right here. Open this manual, which is Walton's Principles of Manipulative Therapy, Manipulative Medicine. And he's looking over his shoulder, and let me have this leg. No. You gently flex, and you place the thenar eminence in the popliteal space behind the knee. It's a little wedge. It's a very primitive, very simple leverage procedure. And imagine that if I've got my hand back behind his leg, kind of notice I have my index finger and my thumb kind of wrapped around his knee, and notice how I'm supporting his fibula. His whole leg is supported. So if I just take this and I just lightly flex it as I turn it out, bless you. As I flex it and I turn it out at the same time and just spring it, and I just spring it again, that's all we're doing. So we're just springing the leg as we turn it out against my forearm, against my thenar eminence. And that's all it took. When he did it to me, it sounded like a shotgun went off in the room. He kind of jumped back, said, "You okay, son?" And I was like in bliss. I was like, oh. It's like chi was going down my leg and there was no pain. So that's all that is. That's all that is.
Elementary, my dear.
Yeah.
What do you say?
Elementary, my dear Watson.
And that turned you into the man you are today.
That's right. It didn't. You know, I haven't written him for years, but I haven't. You know, as I was getting dressed, I was like in tears because I was. Can you imagine how much it hurts to have the fibular head impinge the peroneal nerve?
No.
You know, so I not only had this like rat bite lesions in my feet, which is what they classically describe French foot as, but I had this nerve problem that nobody could solve. So all of a sudden, this one dude makes the medical diagnosis and mobilizes my leg. I didn't know doctors could do that stuff, right? And I'm out of pain. And he said, you know, and we had somebody in common. I was at like way northern county on the coast of Maine. And she told him, the woman who'd recommended him, said, you know, he's been pre-med, he's trying to figure out what he's going to do with his life. You know, you should check out the osteopathic schools. He said, you know, son, I'm going back to Portland, which is where the osteopathic hospital is, and there's a new school that started. They're in their 3rd class now. Why don't you come check out the school? I know the dean there. I know the director of medical education at the hospital. Maybe you should think about being a DO. And that was kind of it. You know?
Okay.
So you had to whack your knee out so
Yeah.
you could become a DO.
In praise of trauma,
There you
right? So I'm here. What I get now is really good breath and flow. I'm supporting. I no longer get this big. Now, there wasn't a crack. You know, I'm not sure whether I moved the bone or I just provided the brain with new data. You know, it isn't the thing about cracking bones. We're not moving bones. We're working with the energy.
Rarely will you get a crack out of that.
What's that?
Rarely will you get a crack out of that.
Yeah. Did you hear Patrick? Rarely will you get a crack
I do
out of it.
that. I do
It
that.
has to get really stuck and fibrosed to crack. So we're just springing it. It feels really good. Both sides feel really good. All right, where do I go from here? 5-pointed star. I can't wait.
What else is on there?
So that was
See?
the violence.
Yeah, can I have that bolster,
Yeah.
please?
Turn this off.
Do you still need it after having a quick one?
That was this stuff.